Another story from OB anesthesia, but this time it's not involving the mom. It actually involves the dad. So I'm finishing up an epidural, bolusing our medication through the catheter when we look over at the husband, who appears to be sort of slouching in his chair, eyes are rolling back, and it's starting to look white as a ghost. The husband had pretty much passed out in his chair, and the medical term for that is what we call syncope. Now, for anyone who's had a kid or has seen their partner go through an epidural, we always ask the partner to sit down in a chair for this exact reason, so that if they do pass out, they're just going to pass out in the chair and not pass out from a standing position, which has much more risk for having other traumas when that patient hits the floor. So let's quickly talk about why people pass out. It pretty much has to do with low blood flow, which means low oxygen levels getting delivered to the brain. The brain is actually really good at controlling how much blood flow is going to the brain over a wide range of blood pressures. But if the blood pressure drops really low, that cerebral blood flow can also drop dramatically. Studies have shown that around 40% of people have experienced syncope at least one time in their life. Majority of the times, the biggest reason why someone passes out is what we call a vagal or vasovagal episode. This is a cardiac reflex that ultimately results in an increase in parasympathetic tone and a decrease in sympathetic tone. So the increase in parasympathetic tone is what's going to drive the heart rate down, and the decrease in sympathetic tone is going to cause vasodilation or a decrease in vascular resistance. If you remember the equation for cardiac output, that's going to be heart rate times stroke volume. So if your heart rate's going down and your stroke volume's going down, then your cardiac output goes down, which means your blood pressure goes down and your cerebral vascular perfusion goes down. Ultimately, this means your brain is getting less oxygen supplied to it. Syncope resulting from a vasovagal episode usually only lasts a few minutes, and patients end up doing just fine. Before they pass out, they may have a syndrome of sweatiness, nausea, lightheadedness, sometimes problems with their visions. If you have someone who syncopizes in front of you, the mainstay of treatment is really just going to be supportive care. What we did in this scenario was, since the patient was already in a sitting position, we elevated his legs to help some of the blood return back to his heart, and then as he started to wake up, we gave him some juice to hydrate him and make sure that his sugar levels were okay. A couple of things that can make syncopizing worse, or patients at higher risk for syncopizing, would be the standing position or dehydration, as both of these can cause a decrease in preload. And a couple things that you want to quickly rule out or just keep in the back of your mind if you see someone pass out could be hypoglycemia, a seizure, or sudden cardiac arrest. In this patient, I went through the ABC, so I made sure his airway was patent, I could tell that he was breathing, and like I mentioned, we elevated his legs to help with circulation. As he was waking up, we brought in a stretcher, laid him flat, and over the course of about 3 to 4 minutes, he was back to his normal self, although a little bit groggy. This is just another example of you never know what you're going to get into in OB anesthesia, and you have to stay on your toes.